Hi, everybody. This is Heather Korbulik, Executive Director with the Silver State Health Insurance Exchange. We have a lot of people on the call today. This is very exciting. We're happy to have you all here on our last call before we go live as a state-based exchange. We are recording this meeting, and so it will be available on our website that we've put together for all of you, our broker and enrollment assisters. So we are, there's a wealth of information there. Some of this will be a repeat from previous meetings, but because we have so many people on, we're excited to kind of share this information and make sure it gets disseminated appropriately. For your information, I have tried to mute everybody's line, but just to be safe, if you wouldn't mind also muting your line, that would be extremely helpful. There is a chat feature that I will work on answering questions after we complete our presentation today. It's kind of a distraction when I'm trying to move through the slides, so I will try to attend to every question we get in the chat box, so please feel free to put your questions in there. But again, this meeting is being recorded and will be posted to our website just as soon as we can dial it up. I can hear some feedback, so it looks like somebody's unmuted, and if you wouldn't mind, please muting mine so that we can make sure.
Sean, this is not anything like I heard from my friends. They have an F.
Hey, we can hear you speaking about John. Excuse me, can you please make sure you are on mute?
It's 0 PPO, you don't have to pay for it. I don't know, she's still back there.
Hello, I can hear you speaking. Can you please mute your line so that everybody can have a better experience? Your line.
She's like, here, let me show this to you in writing. So she's like, you have a $500.
Just so you all know, I'm looking to see if I can find and mute you.
We have talked to a lot of people about this, and we've never heard this before. And she goes, here, it's right here in the book.
Please, that's so frustrating to me. Please mute your line. We can hear you speaking. Okay. It sounds like you maybe got my message there. Thank you. So for the rest of you, please mute your line so we don't have another experience like that. All right. So today is October 22nd. This is our last broker and enrollment professional or enrollment exchange administrator or facilitator meeting before we go live with our state-based exchange. Today on our agenda, we will be talking about who's on the call with us from the exchange, some progress on our transition project as it relates to both technology and the call center, some information about the service line that's available to our broker partners and EES, a little bit of an update on our Mind Flash training and curriculum, and then of course the process to get your full account set up and certified. We'll talk about broker and exchange enrollment facilitator resources that will soon be available to you, some key dates as it relates to our communication to consumers, the Broker Connect tool, how to purchase dental only, redetermination notifications that are in process right now. We're going to get into some information about data matching issues, talk about consumer communication, and then we'll get into the Q&A where we will be able to answer your chat in the chat box. So moving on, the exchange staff on the call today, again, my name is Heather Korbulik. I'm the Executive Director. We have Ryan High, who is our Chief Operations Officer, Rosa Alejandre, who is our Navigator Program Manager, Rebecca Lamazo, who's our Broker Liaison, Janelle Davis, Communication Officer, Katie Charleston, who's our IT Analyst, and Eric Watt, who's our Project Manager for State-Based Exchange Transition. Athena Cox is joining us as our Quality Assurance Officer, and our new hire, Tracy Reed, is a Program Officer who will be specializing in assisting brokers and exchange enrollment facilitators during and throughout the year, but to provide technical assistance on consumers and issues that you experience or don't experience on the platform. All right, getting right into the meat of this, let's talk about where we are with our transition in terms of technology. We have continued to dial in and work very hard on our quality assurance and user acceptance testing. We have narrowed it down to just a little bit of verbiage that needs to be changed and are working closely with the folks at Get Insured to make those changes to ensure that consumers are going to have a intuitive application process and enrollment process. Window shopping went live on October 4th, and that's been going very well. I know a lot of you have been in the system doing different scenario checks for your consumers, and we're happy to hear that. Oh, please make sure you mute your line. We can hear a baby. So we are live with window shopping. I encourage any of you who have not gone in and looked at that to go ahead and do so. Consumers are still claiming accounts. As of this morning, we had nearly 32% of our enrollment who had claimed their accounts, and that's all wonderful. They're going to continue to do so throughout open enrollment, and that's going to be a critical part of making sure that they can complete their enrollment for plan year 2020. October 25th is a big day for us at the Exchange. It is the last day that we are going to receive data from CMS for plan year 2019. So this is our final catch-up data transfer. It's going to include information about anybody who had potentially termed since we last got files in September. It will also include SEPs for 2019, and I do plan to talk a little bit more about that in this presentation. And then it'll also allow us to look at any kind of terminations. So that's all going really well. We've also been working hard on developing a carrier connector. This is not something that our brokers or agents or EEFs will have anything to do with, but it is important that you know that we will have this carrier connector tool, which is a collaborative case management system that will be working between the Exchange and our carriers to manage and resolve consumer complaints and appeals. It's also going to be a tool that will be used between the Exchange and our carriers specific to how to reconcile our databases to ensure that we are all on the same track. Our call center, move forward too fast there. Our call center is been live since September 4th and will be staffed up to our 48 agent requirement by November 1st. The call center right now is averaging about 350 calls a day, with 90% of those being resolved right in that first call. We have considered a lot of great feedback that we've received from our broker and agent partners and have implemented a lot of those changes in our IVR system. So thank you for that feedback. It is appreciated and we do use it. The service lines are available just specifically dedicated to our brokers, CECs, or EEFs, and those, the number for our broker and agent partners and enrollment partners is 1-800-547-8156. Right now, that line is being primarily used by our Get Insured call center staff to help our broker agent EEF partners to create their accounts on the Get Insured platform. The broker support line will be open during open enrollment Monday through Friday 9 to 7 and Saturday 10 a.m. to 3 p.m. The call center hours after OEP or throughout the SEP periods, Monday through Friday, 9 a.m. to 5 p.m. and will be closed on Saturdays and Sundays. Let's talk a little bit about the certification and training. We have closed our window to complete broker and agent or CEC or broker in EEF, I don't know why we keep calling it CEC, certification training and account profile and entity creation until November 5th. So we are asking that you complete your MindFlash training by the 5th and that you establish your profile on Get Insured's platform by November 5th in order to ensure that you are able to assist with consumers throughout the open enrollment period. So once you've completed your MindFlash system training, brokers are required to go in and establish their account on Get Insured. Many of you have done that and have received those emails and follow-up from our staff. And we are available, our call center is available to help you with that. And expedited way to do that is to call that 1-800 number and press 5 to get quick technical assistance on how to finish that account creation. The navigators and in-person assistants, our sisters, have all established their entities and are being listed within, and we're getting their CECs or their certified enrollment counselors listed in those entities and through the MindFresh training. Again, questions on that process can go to our call center, and we are more than happy to make sure that you have all of the answers that you need. Agents and brokers and resources that are coming out here soon. We will have, it's all in my desk and ready for me to walk through and approve, and so in the next couple of days here we will have rolled out on this website where the training will also be, or today's recording will also be posted, which is nevadahealthlink.com/partners-transition. We have a lot of resources there already. A lot of our recorded meetings are there. So if you're new to us, please go and check those out and listen to them. But coming soon, again, those are on my desk, and we'll hopefully have them out of here soon, are the Broker User Reference Manual, our Broker CEC Consumer Application and Enrollment Guide. This is for not just our brokers and CECs, it's also a guide for consumers to use to navigate the enrollment process. I've been through it several times. I will tell you that it is very intuitive, and I doubt that you'll need the guide for very much, but it's available for more complex situations and scenarios. We also have an EEF and CEC user reference manual that is under works and will be posted here soon. All of that will be available again on this website. And I wanted to add that we are currently working on a video that will show brokers and agents how to do an enrollment from your portal, how to add a participant from your portal. All right, some pretty key dates. We talked a little bit about what's going on. We are in sort of a frozen period, although consumers can continue to claim their accounts right now. We are not allowing them to do any kind of changes, making changes to their preferences on auto renewal or designate an agent for the time being, because we are trying to prevent any conflicts with this auto renewal job that we are currently running. That goes through the end of this month. Any consumers, so here's a specialized thing that I'm really looking forward to having a conversation about with you all. Our last data migration is October 25th, and so we will not receive any further information from CMS about any SEPs or added dependents or terminations, disenrollments, till the end of the year. So between October 25th and the end of the year, we will not be receiving any information on that. So if you are helping a consumer enroll in an SEP on healthcare.gov, please make sure that they understand that they need to go to Nevada HealthLink during our open enrollment period and actively create an application and enroll so that they can have coverage for Plan Year 20. We will not be able to cover or carry that coverage over from Plan Year 2019 from healthcare.gov. Again, that's just between the time period of October 25th through the end of the year. Another nuance to that is that consumers who are adding a dependent during this time period after October 25th throughout the end of the year, if they're adding a dependent to their existing plan on healthcare.gov, we will not get that information. So if you're helping a consumer do that, please make sure they understand that they need to go into their Nevada HealthLink account and add that consumer for Plan Year 20 to ensure that that coverage maintains throughout the Plan Year 20 year. And then again, we are not going to receive information on disenrollments. So after October 25th, we won't have any idea about who's disenrolled. The system will eventually clean itself up because carriers will or send us terminations into Plan Year 20 for anybody who was auto-renewed. But if you are helping someone disenroll or cancel their account, please let them know that they're, after the October 25th deadline, please let them know that we won't have that information and that they will want to go to Nevada HealthLink and terminate their policy there so that they don't get any kind of confusing duplicative messaging. So that's specific to October 25th through December 31st. There's no surprise here. On November 1st, we start our open enrollment period. So this is when our migrated consumers can log in and start to edit or modify their application. They can make changes to their enrollment. And then new consumers will be able to create their accounts and shop and purchase new plans. There is something special that we will not be advertising, but that's important for our broker and EEF partners to know. On December 15th, if a consumer has at least started their application but has not yet completed, they've started the application but hasn't completed in purchase or completed in enrollment, we will give them until December 20th to complete that. Please do not advertise that information. We really want to focus on getting people through the open enrollment deadline of December 15th, but you can have in your pocket the knowledge that if they've started the application, have not completed it, that we will give them through the 20th to do so. Our Broker Connect tool is a new feature for us. It's a program that brokers have opted into when they set up their Get Insured account. You have to go into your Get Insured platform and click on the Client Served button in order to be listed in this Broker Connect tool. The call is always going to come from our consumer line, which is 1-800-547-2927. So if you're on Broker Connect, make sure you add that number to your call or your contacts. Each broker is going to get a call that will ring for about 10 seconds. That's about 3 to 4 rings before it gets transferred to the next broker in line. These are randomized referrals, but if you don't answer your phone, we do try to connect a consumer to somebody who can actively speak to them right then and there. So please pick up the call as soon as possible. We really encourage you to use a mobile number for your Broker Connect line. And again, the reference manual that I'll be putting out in the next couple of days will have more information about how to make changes to this phone number, screenshots on how to do that. But we encourage you to use your mobile number so that you do not experience or a consumer doesn't get trapped in your IVR system when they're connected to your organization. So again, to be included, you need to make sure that you sign up for the program by clicking that Client Served, and then be very specific about your hours of availability because the tool will call you during those hours. You can turn this feature on and off when you're on vacation or when you're unavailable to assist people, but please be very clear about your hours of availability so we're not calling you at midnight if the consumer's on there looking for assistance. One of the great changes that we've been able to implement for this plan year is the ability to purchase dental only. So dental coverage is really offered primarily in 2 different ways. It's typically embedded as a part of a health plan or can be sold separately as a standalone dental plan. Standalone dental plans that are not embedded in the health plan are offered and can be purchased through Nevada HealthLink without having to also purchase a QHP. Probably not very surprising to any of those of you who have been trained with us, but under the ACA, dental insurance is treated differently for adults and children who are under the age of 19. It's considered an essential health benefit for children, and so if you're getting health coverage for someone who's age 19 or younger, that dental coverage must be available for your child as a part of the health plan or as a standalone dental plan complemented. So while dental coverage for children must be available to you, you do not have to purchase it. This is a nuance to those rules. Dental coverage is not an essential health benefit for adults, and insurers do not have to offer dental coverage. However, on the exchange, we have 6 different carriers who do offer dental plans, and that information is available on our website now at nevadahealthlink.com. So in terms of splitting the APTC between health insurance and dental insurance, I wanted to just make sure you all understand that applicants who enroll in a QHP and are given APTC must use the APTC first on their QHP. And if there's any remaining amount of advanced premium tax credit, the applicant can then apply that to a standalone dental plan, pediatric only. So we have a policy manual available at this website where you can find more information about that. But I also wanted to ensure that while we're on this page that you all understand that if during open enrollment a consumer wants to shop only for dental plans and does not want to purchase a QHP, they will have to complete the application and indicate that they're not looking for financial assistance, sign that application, and then they'll be able to go and shop just for dental and purchase that dental-only plan. All right, we are getting ready to send out redetermination notices. We are running, like I said earlier, our batch renewal or auto renewal jobs, and so those are going to be going out here soon, but we're also redetermining all of the consumers. And so as a part of that process, we have to run the renewal and redetermination verification service to ensure that that the client is not deceased, that they have filed and reconciled their taxes, that their income is within an acceptable threshold of that which they've reported previously, and that they are not currently enrolled in Medicare. So based on that verification, the redetermination process will provide those eligibility results, and then we use those for the renewal process. Notices will be sent to consumers in the next 9 days here, and those are going to include an eligibility summary for each member in the household. Household members assessed to be Medicaid eligible will be notified as such, and any action that's needed to, that we need to remain or to get coverage will be notified in that notice. We'll talk about any kind of conditional issues. So if, for instance, this is an example, our RRV or that redetermination renewal verification job comes back and says that the income that was reported is not in line with what has been reported on your taxes, we will ask you for information to provide us with clarification on what your income is. You need to provide some kind of notice, and we'll talk about DMI in just a minute, what that means. But that would put you in a conditional status, meaning that your policy is conditional until we see and document that approve of the additional necessary information. We'll provide people with information on their next steps to get connected, and then we'll definitely be connecting them to assistance through you all with resources and contact information for the exchange. So what's a DMI? A DMI is a data matching issue, and there are a variety of different reasons that data matching issues get generated. I don't think this is going to be much of a surprise to any of you who have done business with healthcare.gov. Consumers' data typically isn't matching with what our trusted data services, our sources are telling us, and that's through the Federal Data Services Hub. If and when that occurs, a trusted data source might not have the data for the consumer, or it may not match the data that we've provided. So here's a couple of examples of information that could be missing or incorrect. For instance, if somebody fails to provide a Social Security number on their financial application, if a consumer, or on their applications, if a consumer failed to provide all of the household income on the application, if a consumer maybe didn't or used a name for their application that differs from that which is on their citizenship document, or if a consumer failed to provide their immigration document numbers and ID numbers. So here's how you can help us prevent any kind of issues with DMI. Complete every possible field on the application. Ensure that, and validly, make sure it's valid information. Ensure consumer's name exactly matches the documents that's on their Social Security card or their immigration information. Any non-applicants in the household are encouraged to provide their Social Security number. That's an important part of our financial determination. And then double check that the information on the application is complete and that there are no errors. In our application, we allow you to review the information that's been entered several different times, and there are opportunities to make changes. So really, there's no excuse to miss any of this information or to make sure that there's no errors in it. Steps to resolve the DMIs, you're gonna ask you as broker and agent professionals to help confirm if the consumer has a DMI through their Nevada HealthLink account, and if there is any eligibility notification that they've received that requires additional information. Help the consumer go back to the application to confirm that the information that was entered is correct, and then help that consumer submit documents online or by mail, preferably online, to resolve their DMI. And the way you can submit supporting documentation is, like I said, preferably through Nevada HealthLink's portal. Consumers can upload those themselves through their online account. You can also assist the consumer by acting as their proxy and uploading those documents on their behalf into their account. And if uploading electronically is not possible, which it's 2019, almost 20, let's really hope that it is possible, please be sure to mail it to our processing center, and this is the address. Of course, again, this slide will be on our website for you to review, and that information will be available to you via our website. But I do want to let you know that mailed documents may take several more weeks to process. So again, this is why the electronic is preferable. We have so much communication happening with our consumers here coming up. So at a very high level, let me just let you know that over the past several months, while we've had our soft launch or our claiming account campaign going, we've reminded consumers every week who have not yet claimed their account to go ahead and do so, and we've seen really big jumps every time we're reminding them. So consumers are opening those emails, they're reading things from Nevada HealthLink, which is a great start. October, we will be continuing to send reminder emails to Nevada consumers who have not yet claimed those accounts, and basically what we're saying to them is it's time to get thinking about set up for Nevada HealthLink for 2020 and to go through these 4 steps in order to claim their account. Of course, October 3rd, we allowed everybody to do window shopping. We're launching and have already launched our campaign with the theme of peace of mind that will really ramp up starting on November 1st and run through December 15th. I'm encouraging all of you to please check out our transition video on our website, and then more importantly, please take a look at our social media toolkits. We have developed a ton of content for you to use and share at your free will to make sure that we're getting information out to consumers about open enrollment. November 1st, we are having a press conference in Las Vegas with Governor Sisolak at 11 a.m. So that'll be a good start. And then on November 7th, we're having another press conference with Governor Sisolak here in Carson City. Both are to talk about the importance of open enrollment and getting enrolled during that time frame. Throughout the month of November and December, we will also be targeting consumers with weekly email reminders, telling them that they've started but haven't completed their enrollment, and then working on targeting email reminders to complete their application and enroll, and we'll be sending that out to existing and new consumers. December 1st through the 15th, we are going to be doing a countdown for those consumers who have not yet completed their applications. We'll start a countdown reminding them that they need to get in there and finish the job. And our focus is really in the messaging this year about Nevada HealthLink being the only place to enroll for plan year 20, the only place to get financial assistance, and the only place to connect to certified and qualified enrollment assistance through all of you. I see a lot of chats, and so I'm going to just break here and take at least some of these. Hold on, please. Can we have a copy of the slideshow? Yes, like I said, it's going to be available on our website. Oh, okay. It sounds like Janelle just came in and told me she answered some of your questions, so I'm going to try to, oh, yeah, here. Okay, sorry. Lots of thank yous. Okay, if our client does not claim their account, will they need to make a new account if the agent has the client's information linked to them? No. Our clients will be prevented from making new accounts. If we already have your information in our system and a consumer tries to go in and start a new application, the logic in the system will catch you one way or another, whether it's your name, whether it's your social security number, whether it's your email address. We will say, oh, it looks like we already have information on you. You need to claim your account in order to complete your application, and so we will prevent people from creating duplicates. But if a consumer does not claim their account and they are eligible, meaning they've opted in to auto-renewal on healthcare.gov, then we will honor that auto-renewal, and that's what the job we're currently working on right now. We will auto-renew them into the same plan or the most similar plan available to them in time for the November 1st start. They can make changes all throughout open enrollment should they want to. You, acting as a proxy, can help that consumer make changes to their account and in their enrollment if they so choose to. I'm not really clear on that question, so I'm going to try to move forward. Okay, some of these I'm going to have to reach out to you directly because they're very specific. Can you use remaining APTC to put towards adult dental? No, the rules are that you can only use remaining APTC for children's and pediatric dental. Okay, I'm going to skip back to my slides because I think there's a lot of these that Janelle has been answering. Okay, so one of the questions that we received was whether or not we will be able to make the first premium payments for our clients through the broker portal. I love that question because that tells me that you know that we have to effectuate payment in order to ensure and bind the coverage. So yes, you may assist a consumer to make their first premium payment through the consumer portal once you've completed their application, or if it's a new consumer, once you've completed the application portion, then you've gone to the plan summary button after you've selected the plan that you want. You can press a button that says pay for your health insurance, and that will auto-link you to a payment redirect page for the carrier in question. It sends them what's called a SAML file, which is basically a lot of the 834. These are very technical things, and I'm proud of myself for knowing, but basically we will be redirecting with all of the information necessary for the carrier to ensure that they are binding the payment of that specific policy for that specific individual. So at the end of your enrollment process, there is an opportunity to go and pay for the health insurance, and that is that's how you bind your payment, and it goes to those pages for redirect. This is a kind of a specific question. There's a couple that declared $23,000 in income in 2019. When that number is used for 2020 window shopping, it says Medicaid eligible, presumably because the threshold increased as they do every year. If that couple does nothing, will they auto-renew into a subsidized plan based upon that around $23,000 income that they implement or that they input, or will the system kick them out, cancel their plan, and push them to Medicaid? The answer is this consumer will be renewed into a QHP without APTC. However, their account will be transferred to the Division of Welfare and Supportive Services to confirm eligibility of Medicaid. Once DWSS confirms Medicaid eligibility, they will be disenrolled from the QHP and receive notification from Nevada HealthLink. What happens to people when they set auto-renew and their income is below the threshold for an on-exchange QHP plan but do not proactively go up and update their application even if they did claim their account? It's basically the same answer as we provided before. Okay. Is there a way for from my book of business to know which of these folks are set to auto-renew and if they have claimed their account or not? Unfortunately, because this is a one-time transition-specific transition that requires claiming an account, this is the one time they're going to need to do this, we do not have any tools available for our broker partners to see who has currently claimed their account. And so I apologize, but there isn't a way to do that. We can help you if you'd like assistance. You can reach out to Rebecca Lamazzo, and we will try to help you understand who has. And unfortunately, you will not be able to see who is eligible for auto-renewal either. That's just not a part of the functionality of the Get Insured platform. Somebody asked if you have, or if a consumer has a $0 plan, will they have to register a credit card with the carrier? And the answer is no, they will not have to register a credit card with the carrier. Another question we had was, will brokers receive electronic updates as to the activities of consumers and their book of business? The answer is yes. Brokers will receive a daily email that summarizes the activities of consumers in your book of business. You can log into your portal and see all of the consumers who have outstanding issues needing assistance or your attention. We do not send an email with each notification or each change, but we do send a daily summary. If a person may qualify for Medicaid, is that information being sent automatically to Nevada DWSS like it did from healthcare.gov, regardless of whether the consumer goes with that eligibility? Yep, that information is being sent through an auto transfer to the Nevada Division of Welfare and Supportive Services. And the next question is, if they take a QHP in the meantime while it's being reviewed, or can they? And the answer is that we won't deny someone for signing up for a QHP. However, if that consumer is possibly eligible for Medicaid, or it looks like they are, they will not be eligible for APTC if they push ahead with their application, which will make the QHP, of course, more expensive to the point of likely being unaffordable. But it should be noted that Medicaid does backdate to the date of application pending approval, so any expenses that are incurred would be covered to whatever level Medicaid covers. So it's not necessary to sign up with a QHP while you're waiting on your Medicaid determination if you are sure that you are Medicaid eligible. All right. We're noticing that APTC went down and premiums went up. Situations, I have to say, situations are variable depending on individuals' unique needs and their makeup and their geographic location. So there was a federal rule change that seemed quite minor in the way it was finalized, but it effectively changed the premium indexing on subsidized plans. So consumers who are receiving some subsidies may see that they have an increase in their personal responsibility, and they've seen a decrease in their APTC generosity. So ultimately, some consumers, this shouldn't be, it's not universally applicable because rates went up in some areas and rates went down in some areas. And again, this has a lot to do with rates and geographic areas. But there was a rule change that decreased the amount of subsidies given and increased the amount of patient responsibility. Will a new consumer I helped enroll after our 10/25 date or effective 11/1 be automatically added to my Nevada HealthLink portal for 2020, or I need to do something special? The application enrollment is not going to be provided to us after October 25th. So you will need to ensure that that consumer, if they're effective, if we've got their information, meaning we got it in our last data migration, then you can help them claim their account. If you're doing an SCP after the 10/25 deadline, then you're going to need to make sure that that consumer gets set up with a new account on Nevada Health Link in time for plan year 2020. How is DMI documentation going to be submitted? We talked about this earlier. The preferred method is through the enrollment portal. Consumers can log into their account, or you can work on their behalf and upload those documents through the Nevada Health Link portal. Again, we said that there's a mail, and we have this is part of our frequently asked questions, and these are located on this web page. And again, this information will be uploaded to our website hopefully within the next 24 hours. All right, I see more chat, and so I'm going to try and go back and figure out how to be savvy about it. Okay. This meeting is being recorded. I see many people asking that question. It is being recorded. It is available on our website. With online submitting, will we be required to use a cover page? I'm sorry, Suzanne, I don't know what you're asking, so I'm going to move on to the next question. Okay, there was a question about some accounts that were trying to be claimed that were getting heirs, and they've been told by our consumer service representatives that they need to come back on November 1st to address those heirs. I want to assure you that this is a problem that is specific to very few people. And what's happening in this space is that when we got the information from healthcare.gov, those individuals came with multiple applications. So they didn't just have one application for one individual, they had multiple. And as a part of our migration, we had to come up with some solutions on which one is the right one. We've worked closely with our carriers to make sure that we have the right enrollment information. And unfortunately, those individuals will not be able to claim their accounts until November 1st, because that's when the fix for those duplicate applicants will be automated and available. I know that we are receiving some people are concerned about the amount of communications that they're receiving from Nevada Health Link. I appreciate that perspective and wonder and appreciate your feedback. I just want to also just remind people that if a consumer has claimed their account, they're not going to get any more communication from us. So it is a kind of a necessary evil in a lot of ways to encourage people. This is what healthcare.gov does to encourage people to make sure that they complete their applications and finish their enrollment, and then you are blissfully not hearing from us anymore. So there are some questions about losing tax credits and expedited requests. I want to let you know that we are working very carefully with our appeals team to develop a method and mechanism to try to do everything possible to resolve consumer issues informally before they ever have to go to a formal appeal. And if they do go to a formal appeal, we will be very rigid about making sure that we follow the Code of Federal Regulations timeline to ensure that person gets the fair hearing that's necessary. But we will be following the Code of Federal Regulations definition of what makes for an expedited appeal, and that really has everything to do with people's life and health being in jeopardy as a result. Somebody asked if we are enrolling a new client or renewing a client, can we do it all through the broker portal? Yes, you can add new individuals. The manual that we will put out will show you how to do this through your portal and do their entire application there. They don't need to be on their own computer to finish that. You can also renew clients that way and help them through your own portal as long as they are affiliated and designated to you. You can enroll them under your own accounts. I work for a brokerage firm, and this presentation is, do I need them to direct people to Nevada HealthLink and have them assign me as their broker, or can we help them there? Yeah, unless you're sitting with a consumer, the way to get paid commissions is to add and have consumers designate you and accept, you need to accept their designation in order to ensure that the carrier gets information about your affiliation on that enrollment. Is there an income guideline tool on Nevada HealthLink similar to the one on healthcare.gov? I'm going to have to ask that question and get back to you, to the person who asked that. Yes, you can shop and preview plans anonymously. Those are all available right now on Nevada HealthLink through our window shopping portal. You can compare plans. You can specify very specific things for individuals. It looks a lot like it does after you complete your application and go towards selecting a plan for the next plan year. So go in there and take a look right now and get yourself familiar with the plans that are available. There's a lot. So what do we do when the information that was transferred from the marketplace is incorrect? So once we get into open enrollment, effective November 1st, when a client is in their account and they see that that information is incorrect, you can make changes to the Nevada HealthLink application and portal there. You can make changes to the makeup of the family. You can make changes if someone has been divorced and that information was not accurately migrated to us, then the opportunity to make those changes is effective November 1st. Okay. Will we be able to see the CSR level received? That's a good question. I'll have to get back to you about that. You definitely see the APTC that's available to you, and I need to just check on the CSR. I think it is available once you get into the breakdown of your plan summary, but I just want to make sure because I haven't looked at that specifically. Okay. Yes, so if a consumer gets pushed to Medicaid and gets denied in January or February, will they get an SEP to enroll in a QHP with APTC? The answer to that question is specific to the individual. So if you go and you're uninsured right now, and you go and apply to Medicaid and you get denied Medicaid, because we're in a special enrollment period, you don't get to you don't just have a qualifying life event because you were denied Medicaid benefits. I need to get back to you on the specifics on whether or not if we've pushed your application to Medicaid, does that result in an SEP? I'll have to get right back to you. And I'm looking at my team asking to help me get that question answered. Do you have a link to the broker login? Yes, we will follow. I will have Rebecca Lamazzo follow up with you, Nicole, and try to get that directly to you. If a consumer is not eligible for Medicaid due to an immigration status, will they still receive APTC? It depends on the Affordable Care Act standards of whether or not their immigration status can and will receive APTC. I can assure you that the logic of the Get Insured platform will not allow someone who isn't in the appropriate immigration status to receive APTC. Those rules are not changing with Nevada HealthLink. I'm going to have to, because we're running kind of short here, I just want to make sure that we get to the ones that are maybe a little bit more universal, so I'm skipping a little here, and we'll get back to you guys individually. The same question I've seen lots of times about whether or not an insured person has to create an account or if a broker can do it through their portal. And again, you can do it through your portal. You can create and solidify. Oh my gosh, we're getting 20 new messages. Wow. All right. This is what you get when you have 150 people on a call. So I don't know what that means. Okay, what about clients that were enrolled in the marketplace plans effective in November or December? Like I said earlier in this presentation, anybody who's enrolled, if you're doing an SEP enrollment on healthcare.gov for plan year 2019 after October 25th, please know that we will not have that information. You will need to make sure that that consumer goes to Nevada Health Link, creates a new account, and enrolls for plan year 2020. If you are helping an existing consumer add a dependent, please also make sure that they go to Nevada Health Link, add a dependent after October 25th, go to Nevada Health Link and add that dependent to your application with us, because we will not have that information. We are working with our carriers to try to get them to do some very specific messaging to those people, and they are agreeable, but we're concerned about those folks and want to make sure that they don't get a lapse in coverage. All right. Yes, we will send all of you requesting the broker link. Thank you for asking. And I think I've hit a point where I've answered at a high level most of these questions. We are going to work very hard to get back to each of you individually if I didn't specifically answer your question. So I am looking forward to a successful start to open enrollment. We appreciate all your partnership and support. Let's go out there and enroll more Nevadans. We know that there are about 77,000 Nevadans right now who are eligible for subsidies on the exchange who are not currently accessing them. In total, 120,000 Nevadans who are eligible for exchange but aren't getting on them. 77,000 of those folks are eligible for subsidies. So we've got work to do, and we're looking forward to partnering with you, and thank you for your time, and we will get back to each of you on the questions that you've asked here. Thank you again, and have a good afternoon.